The healthcare industry currently collects and stores massive amounts of private data, from credit card numbers to health and social security numbers, from a wide range of individuals. These can be celebrities, sports celebrities, or local media and government celebrities. And this data generally is stored in an electronic format that can also be stored in a paper format. And this data is easily lost and stolen by individuals seeking to gain financial advancement through the use of this data. Historically, health systems used paper records to store data. And on the advancement of heading to what they call electronic health records, the majority of this data is now being transposed onto an electronic format. The physicians within hospital systems generally use laptops or handheld data palm readers, which store a lot of data. They're very easy to lose. And sadly, with the laws in the US, once you've lost something like this, you have to then involve the regulators and everything else in making sure that the data breaches are communicated to the public, and that credit monitoring and various steps are put in place to ensure that the data is protected and that affected individuals are recompensed for it. There have been certain high-profile incidents of breaches publicised in the media, and the resultant cost of those profile breaches to the healthcare industry has a massive impact on the bottom line. I think it begins with a lack of data security awareness. Generally, most computer systems have some kind of password that you need to use. Generally, you'll find the passwords are generic. There's no data security behind the password. It can range from disgruntled employees picking up a handful of files, walking out the office and leaving them on a park bench, and then phoning the media to tell them they're there. It can range to cyber criminals attacking a system and then, making contact with you and telling you that we're in your system, give us $5 million or we'll release all your data into the cyber world. So there's a myriad of ways it can be exposed. One of the biggest ways is purely through loss of laptops. It's human nature to leave your laptop on the passenger seat of your car. Someone comes along, smashes the window, takes the laptop, there's a data breach. But on top of that, there are also man-made disasters. A recent cyclone across the US blew out all the windows in a hospital and scattered patient data over a 15-mile wide area. That is a data breach. Some policies that you can purchase will cover for it, some policies don't. The problem with the majority of products on the market right now is that they're reactive. So there has to have had a breach, there has to be a loss of data, there has to be a monetary value attached to it before an insurance policy will kick in. And that is the nature of an insurance policy. There has to be an insurable interest for it to happen. The BMS healthcare practice takes a slightly different approach to that, and we partner with a company called Identity Theft 911, who are based in Arizona, who are a proactive and reactive data breach company. Using their proactive services, we ask them to visit with our hospital clients, do a full drains up, deep dive review of all of the systems, and make various recommendations as to how the security system can be enhanced to make sure that to reduce the ability for there to be a data breach. The BMS healthcare practice has a degree of many years of experience. We come to it with a slightly different take in the fact that we are independent insurance brokers. We are not linked to the use of in-house solutions for our clients. And what we've done is we've partnered with best-in-class experts in various different fields. And with Identity Theft 911, a recognised expert in the area of breach and security and privacy, we utilise their services for the advancement of our clients and for a better management of their exposure. We'd rather not be a completely reactive service. The idea that we have is we want to manage the insured's total cost of risk. And that, when we say total cost of risk, we mean everything from insurance premium right the way down to allocated loss and adjustment expenses. And the best way to do that is to mitigate risk. And by using proactive services, certainly in the privacy and breach arena, we can then manage the costs on the reactive side of it.